Welcome to the Tech Talks Daily Podcast, where you can learn and be inspired by real-world examples of how technology is transforming businesses and reshaping industries in a language everyone can understand. Here is your host, Neil C. Hughes.
Welcome back to the Tech Talks Daily Podcast. Now, as we approach 12 months of lockdown, I am increasingly being asked the same question. And for this, I haven't got surnames here. People have only emailed with their Christian name, but I have Emerald in the US, Alan in the UK, and Graham in Australia. Have all asked in slightly different ways, but what have I missed most from our old worlds to how we're living at the moment? And like I said, it is a question I seem to be getting a lot at the moment. And as a guy that sits in a small room recording a podcast every day, and when I'm not doing that or editing those podcasts together, I'm sat at a keyboard writing articles on my own columns or ghostwriting stuff for other leaders or businesses. I have to say, it's travel. I never thought I'd say this, but I now miss a 10-hour flight for a 3-day conference and having my body clock messed up by jet lag. And I miss catching up with work at 35,000 feet where there are no notifications and no internet, where you're just completely offline. And I also miss random conversations face-to-face on a busy show floor. And then also during downtime, getting away from that conference and going on my own mini adventures in somewhere that I've never been before. And I have very fond memories of so many of those trips. One in particular before lockdown was a trip to Armenia. And that was for a tech event that had Kim Kardashian, Serge Tankian from System of a Down, and Gary Vaynerchuk all under the same roof. And you would never put those three people in the same event anywhere in the world. So it was a fantastic event. And I found myself interviewing at that event Gary Vaynerchuk in front of around 100 people that were waiting for me to finish just so they could push me out the way and grab a selfie. A completely bizarre moment, but it's that kind of stuff that I miss. It's mad as toast, mad as a box of rocks, but I love it all for those very reasons. And one place that is on my wish list, I know we have a lot of US listeners to this podcast, is Texas. I'm getting more and more guests from Austin in particular, and I've never ever been to South by Southwest, so there's an event I need to tick off my list. So hopefully one day I will make it there. But I think it will cost me a little bit because I've promised an increasing number of guests, barbecue and bourbon on me if we ever get to meet face to face. And the reason I mentioned that is today's guest is Matt Dale from Point Health. And yes, you guessed it, based in Austin, Texas. Where as we record today's episode, they're having copious amounts of snow and everywhere's freezing. It feels like a bizarre world at the moment, doesn't it? Now, the company recently announced it was to acquire the Karis Group, an Austin-based company with 25 years of experience in healthcare billing negotiation and patient advocacy. But what happens when those two worlds of traditional health and health tech startups collide? That is what we're going to find out. So buckle up and hold on tight so I can beam your ears all the way to Austin, Texas, so we can speak with Matt Dale from Point Health. So a massive warm welcome to the show. Can you tell the listeners a little about who you are and what you do?
Yeah, absolutely. So my name's Matt Dale. I'm the CEO of Point Health. Point Health is a tech company based in Austin, Texas, and we're working on what we like to call a smart healthcare platform. There's lots of things that are done inside of healthcare that are probably not done in the smartest way possible, and we're trying to change that.
For people hearing about you for the first time, Point Health is a digital healthcare startup over there in Texas. But can you tell me more about how you're using technology to solve these real-world problems that the industry is facing right now?
Yeah, absolutely. So, I think inside of healthcare, you've really got a lot of challenges. And maybe if I start somewhere other than healthcare, let me start with shopping in general. If there's one thing that Americans are really good at, they're really good at shopping for things. And so if you were to ask somebody over here in the States, where do you go if you want to buy, household goods? They would say, well, you can go to Amazon.com. If you ask them, where do you go if you want to buy groceries? They would say you go to Kroger's.com. If you want to get food delivered, they'd say, well, you go to Grubhub or you go to Uber Eats. But if you ask somebody, where do you go to shop for healthcare? It's a question that people have a really hard time answering because nobody's actually been able to build a technology powered marketplace that allows you to shop for healthcare services. There's certainly people that are trying, but there's no company that's become a household name like Amazon, even though healthcare is, a $5 trillion business. And I think in order to do that, there's really three things people need in order to make an informed consumer experience about what they're going to shop for. They need to be able to understand what something's going to cost. And while that sounds incredibly simple, in healthcare, it's been incredibly confusing to do. The healthcare has really profited off of there being a lot of confusion inside of the marketplace around what things cost. And so no one's been able to come out and say, sort of transparently, here's what you're going to pay for a knee surgery at this facility. Here's what you're going to pay at that hospital. It just simply hasn't been done. I think the second thing people need in order to make an informed decision is they need to have information about the quality of the care that they're going to get. And while healthcare quality can be measured, it's not the easiest thing to do because you have to take a look at massive amounts of data. You've got to take a look at things like comorbidities and what did people, when someone went in for a medical procedure, what other conditions did they have? And then you have to look at things like, how frequently were they readmitted to hospital and that type of stuff. But if you can marry price with healthcare quality, and then the third factor being what I would call a rating system. What was the consumer experience like? How long did the doctor see them for? How easy was it to get parking? All of those types of things. If you give them those three pieces of information, they can shop for healthcare the same way they shop for everything else. And so that's what we're trying to do is really take the shopping experience that people are used to in every other industry, make it work inside of healthcare.
Love that. And you did dangerously take me off topic there when you were talking about other experiences outside of healthcare. So I'm going to put you on the spot here.
Sure.
And say, if you wanted the best barbecue in the whole of Austin, where would you go for that?
So, common wisdom is that the best barbecue in Austin is a place called Franklin's. And if you Google, best barbecue places in the world, Franklin has actually been rated certainly in the top 5, multiple times. And I think they've been rated number 1 in the world a couple of times. If you were to ask me personally, I would say the best barbecue is at a place called Rudy's. Rudy's is actually a gas station that has a little barbecue joint inside of the gas station. And I think hands down, they've got the best ribs anywhere. So Rudy's is my vote, but the average person in Austin would probably tell you Franklin's.
Man, I love that left field suggestion. Absolutely love it. And back on to healthcare, I could talk with you about that stuff for hours, but on the subject of healthcare, I am conscious we all have people listening from all over the world and outside of the US. So can you tell me a little bit more about the issue of healthcare accessibility in the US and just why transparent pricing is so critical?
Yeah, absolutely. So in the US, you have a very unique problem, which is that the US has neither taken the one payer system like the UK has, where there's obviously price controls in place and the government has sort of a lot of influence and control over the healthcare sector. But they also haven't taken a true free market approach. So in a free market system, you have a consumer who's concerned about the cost and someone who's trying to sell them something, and they sort of work out a price. The US has an unusual system where healthcare is delivered to the consumer through a very complicated network of carriers, the insurance companies that sell health insurance, which is normally sold through a network of brokers and agents into the, an HR director at a company. And then a company normally provides health insurance for their employees. So the consumer of healthcare, the patient, isn't actually the one that pays for it because it's normally covered by their work. The health insurance companies, because of some, I would say, unintended consequences of bad legislation, there was some legislation that was passed in an effort to control costs that essentially said that insurance companies had to spend 80% of the premiums they collected on the cost of actual care themselves. So that means legislatively, insurance companies' profits or sort of operating income is capped at 20% of the premium revenue. And then so you've got two stakeholders, the consumer who isn't motivated to be concerned about cost because he's not paying for it, health insurance companies that are actually motivated to see costs increase, because the only way their pool can get bigger is if total premium dollars rise. Then the third major stakeholder being the medical providers, which are for-profit institutions, who, of course, they're interested in seeing costs come up. And so what that system has done is it's created a healthcare system in the US where, well, inflation in this country is typically around 2 or 3%. Medical inflation is often anywhere from 15 to 20%. So the cost of healthcare is constantly, outpacing the cost of inflation in general, because two of the major stakeholders want to see costs go up. And the third, the consumer of healthcare, doesn't really carry the weight because they're not typically the one paying for it. So I think I might have answered a question there. I don't know if I actually answered your question, which was about why does that make price transparency important? I think if you're going to introduce free market principles into healthcare and try to use the free market to bring down the cost of healthcare, the place you have to start is you've got to start by giving people an understanding of what the actual costs are. And one of the ways that I like to look at it is, even if you left all of the other things about healthcare that are, being honest, kind of dumb in the way that they're done, exactly the same, if you introduce price transparency, enough people that are actually concerned about the cost will make changes. So the people that are concerned about the cost at the moment are the C-suite inside of the companies that are responsible for paying for healthcare for their employees. Healthcare is typically, after payroll and office space, the third biggest line item on a CFO's, P&L. No company would allow their employees to consistently, book a hotel room or an airline ticket that was 10 or 15 times the cost of another hotel or airline ticket. But it happens inside of healthcare because no one can understand what the costs are. You introduce price transparency, people will start to demand that the healthcare carriers put in place protections to really incentivize consumers to go to low-cost medical providers.
And I'm curious, what was it that made you start Point Health? Can you remember the big motivation there from your point of view?
Yeah, absolutely. So, I kind of have to, go back to the beginning and talk a little bit about my experience inside of healthcare in general. So, I started working for a company called the Karis Group. This is in 2000, and I started there right out of college. And I was there from 2000 to 2010. I left in 2010 and went and did a couple of other technology startups that were acquired. And in 2014, when I sold the second one, I basically retired, and I took 3 years off, and I just hung out making YouTube videos with my daughter. But I stayed on the board of the Karis Group, and they kept asking if I was willing to come back. And in 2017, I agreed. And when I came back to the Karis Group, one of the things that I was really surprised about was the Karis Group is essentially handling healthcare the exact same way that it had handled it in 2010 when I left, which was the same way it had handled it in 2000 when I started, which was the same way it had handled it in 1996 when the company was started. And somewhere along the way, they missed the fact that in 2008, there was an event that changed everything, and that was the release of the iPhone. The iPhone changed the way the world worked, and it put a level of technology into the hands of consumers that changed almost every industry out there, from, how you interact with your friends to how you hail a taxi. It just absolutely changed everything. And the Karis Group had missed the healthcare, had missed the opportunity to change healthcare that came with the release of the iPhone. So I spent the next 3 years from 2017 to March of 2020, really trying to get the Karis Group to make the leap to a technology-focused company. And I kept sort of running into challenges with that. And so in early 2020, I finally decided it was time for me to leave. I didn't want to, butt heads with the rest of the management team around the direction that I thought things should go. And I left to go start Point Health, to say we're going to do healthcare the right way. We're going to do it a smart way. We're going to introduce a level of technology that healthcare, has been sorely, missing. And when I left, I told the owner, I said, there's a series of things that you need to watch out for. And I said, you've got some challenges in your business that if you're not paying attention to, they've got the potential to cause its collapse. And about a month after I left to go start Point Health, he reached out and said, you know what, you're right. Everything that you told me was going to happen is happening. Would you be willing to come back to Karis and help fix these problems? And I basically said, I've been telling you about these problems for the past 3 years. I said, the only way I'm willing to come back is if you'll sell me the company. And so I agreed to buy the Karis Group, the company that I'd spent most of my working career at, and merge that into Point Health. And so Point Health is a startup, but we've also acquired a 25-year-old legacy business that I am incredibly familiar with. And that's how I got into Point Health. It's the next chapter of the 20 years that I've spent working in healthcare.
Wow, what an incredible story. And presumably that allowed you to prove Point Health and the difference that it could make when you've got the failing side of things there, and then you incorporate it into Point Health, and there's a big difference. How long did it take for that kind of those kind of changes to take effect?
Well, I would say this is where the rubber meets the road, right? Yeah. So I've had a year to build the technology platform. It's at a place where in 2021, it's going to be released. And so this is the year where we'll figure out whether, my mad ideas have merit or not. So, as an entrepreneur, this is, I think, the most exciting stage of a company's journey is when you've built a product, you're ready to take it to market. And, this is where we find out if it works.
Wow, I love that. And healthcare billing is an incredibly complex system in the US, especially for our international listeners that might be on the outside looking in. But how is it that technology can change all that?
Well, I think our goal is to make things easy to understand and to make it simple. Healthcare is incredibly confusing. So, I'll give you an example. But we had a guy that came to us a few months ago that was needing a rotator cuff repair. And a rotator cuff repair is a relatively simple procedure. It's an outpatient surgery. It's not something where someone's going to be in the hospital for, a long time. And he had an insurance plan that in this country, we would call it a limited benefit plan, where it pays, a set amount regardless of what the cost is. And the amount that this insurance plan was going to pay for a rotator cuff repair was $3,000. The problem was the only facility that was in network was the large local hospital, and their cost for the procedure was $67,000. So the patient would have been responsible for $3,000. The insurance would have been responsible for $3,000, and the patient would have paid $64,000. Now, if the patient had just shown up at the hospital and said, "Hey, I'm self-pay, I don't have any insurance," the hospital would have given him a 50% discount and would have reduced it from, $67,000 down to, around $36,000. But if he had gone to the local surgery center down the street, he could have got the whole thing done for under $10,000. Wow. And so you've got this incredibly confusing system. Like, it's crystal clear to me that the system is broken and he needs to go to the surgery center. But it's only clear to me because I've spent 20 years working inside of the system and understand the difference in pricing between ambulatory surgical centers and major hospitals. But for the average consumer, they have no way of deciphering, that level of information. They're told by their insurance company, "Hey, go to this facility. It's the one that's in network. It's the one that we want you to go to. And it's actually the most expensive one that he could have picked." But you see that type of problem all the time.
Like I say, it's such a huge problem. And for any families listening, do you have any stories of how families can navigate, or how you help families navigate thousands of dollars in healthcare bills each year? Because it'd be great to hear some real life use cases or stories there.
Yeah, absolutely. So, if someone right now has access to our services, here in about a month, they'll be able to, just download the Point Health app and type in what type of procedure they need. and we'll tell them, here's a list of the facilities close to you that are able to do it. Here's the cost that you're going to pay at each one. Or they can call into our call center, and one of our patient advocates will sort of guide them through that experience. And then the other service that we have is we have a negotiation service. If we can get involved in a medical incident, I would much rather get involved in it early. I would like to be involved in a medical incident at the point where I can tell a patient, here's where you should go. You're going to receive a high level of quality of care and a good cost of care. But if we can't get involved in it early enough to influence where they go to, if someone reaches out to us, if they have access to our services and they've already incurred a bill, we'll certainly reach out to the provider that they went to, and we'll negotiate for them the best sort of payment arrangements we can, depending on their financial situation and their ability to pay. A lot of times we're able to help people qualify for assistance and get the bills significantly reduced or help negotiate a settlement. So if someone's looking to do it on their own, it's challenging. I think as a general rule of thumb, let me share a brief story where I think this is what really brought it into light for me. Is there's a big hospital system here in the southern U.S. It's called Ascension, and here in Austin where I live, they run Seed and St. David's, and I'm sitting in the COO of Ascension's office. So one of the C-suite people at corporate Ascension, and I'm talking to her, and she basically says to me, she says, Matt, you've got to stop coming to me and trying to convince me to give self-pay patients a better price. If you want patients to get a better price, keep them out of the hospital. We have all of these things that we have to do. We've got to have a helicopter outside because we're a level 1 trauma center. We've got to have all of these staffing requirements that they meet. If you want your patients to get a good deal, tell them to get a procedure done anywhere other than a hospital. And that's the single biggest piece of advice that I can give somebody that's trying to navigate the American healthcare system. If you need something done and you can get it done outside of a hospital system, absolutely do that. There are certain things that you can only have done inside of a hospital. If you need an organ transplant, or if you've got, a major surgery that you're having, you have to get that done in a hospital setting. But if you need to see a doctor, you need to have lab work done, you need a simple orthopedic procedure, go to an ambulatory surgical center. You're typically going to pay, 50 to 70% less just by choosing a non-hospital facility to have it done at. So that would be the best piece of advice I could give them.
And if we have any business leaders or decision makers listening within organizations, what are the biggest challenges that you see for employers that are looking to provide better care for their employees? Is there anything that you see there?
Yeah, so I think you can divide how employers tend to think about cost for their employees into two categories. I think you can divide it into people who are managing the problem, and the way that you manage the problem is, you can look at the health insurance plan that you provide for your employees. You can look at, creating a self-insured group, all of those types of things. And then there are people that are trying to get ahead of the problem. And this is people that are putting in plans, wellness programs, and things like that, so that they can help their employees live healthier lives. And I certainly recommend that you take both approaches. Put a wellness plan in place for your employees. Look at the things that are the major drivers of healthcare costs, things like obesity, things like smoking. Put a plan in place to help your employees with the challenges of life that cause long-term chronic medical conditions that drive up costs. And then also, secondary to that, make smart decisions around the insurance plans that you pick. For any business owner out there, if someone were to sort of, put me on the spot and say, what is the best plan I should get for my employees? I would absolutely say, without a doubt, you want a plan that incorporates some sort of non-insurance alternative like cost sharing. The company I recommend is Sedera Health. If you go to sedera.com, you can look at the alternatives they have for health insurance. It's an awesome plan. You need to marry that with a traditional health insurance plan for employees that have pre-existing conditions. But that's sort of, I would use something like Sedera as the building block for your health insurance benefit that you provide for employees. Then I would look at putting a wellness plan in place as well.
And it does feel like we're going through a period of unprecedented change right now. And even if we put the last 12 months aside and everything that's happened with COVID and the changes that's caused in society, we've also got today, as we record this podcast, I know they're in Austin, Texas, you've had snow, which is just absolutely insane. And as a result of extreme weather, you've got power issues, etc. So considering all these changes going on all over the world, where do you go from here? What is next for Point Health?
Yeah, so I think what's next for us is I think we want to start by bringing the type of technology that's been applied to other industries. We want to bring that into the healthcare world. This is an example. Like when I start talking about challenges that companies have with technology in healthcare, I think this brings it into focus. The primary way that you send information to a hospital still today in 2021, if you reach out to the financial department of a hospital, is by fax machine. If you wanted to send them a letter, explaining why you thought your bill was too high, they're going to give you a fax number and say fax it over. And that shows just how far behind the technology is inside of the healthcare system. So the first thing we want to do is we want to help the healthcare system catch up to where the rest of industry is. I think the second thing that we want to do is and this is why I'm sort of talking about, what's the vision for Point Health, 5, 10, 15 years from now. I think we really want to play a role in completely changing the way the entire system works. There are so many things about the healthcare system in this country that are just, fundamentally broken. And I believe that there is absolutely just a better way that you can do healthcare if we are able to disrupt the system that has led to the inflationary healthcare prices and put a better system in place that takes free market principles and applies it to healthcare. That I'm going to look back on my career and say, hey, that was a life that was spent, working on something that made a huge difference.
And I'm sure there'll be many people listening that will completely agree with what you said there and the sentiments behind it. And for anyone listening that would like to find you guys online or contact your team if they've got any additional questions after listening to this conversation today, what's the best way of doing that?
Yeah, the best way to reach us would be to go to just pointhealth.com. Or you can connect with us on any social media. If you Google Point Health, you can find us on Twitter, LinkedIn. Anyone that wants to connect with me personally, you can go to my personal website, matthewdale.com, and reach out to me, and it's got connect links on there to all of my social media.
Well, I wish you the best of luck with Point Health in the future. I think what I've loved more than anything about our conversation today is the rich story behind this digital healthcare startup that just started out on a mission to make healthcare easy to find, easier to understand and easier to afford for members of insurance plans and healthcare sharing organisations. And like you said at the very beginning, it's the iPhone that probably started this period of change because we do want everything simplified. So thank you so much for sharing that story with me. And who knows, maybe when all this lockdown talk is over, maybe I'll meet you at Rudy's and we can test that barbecue out. But more than anything, thanks for joining me today.
Thank you so much for having me on. It was an absolute pleasure.
A big thank you to Matt for talking about the issue of healthcare accessibility in the US and why transparent pricing is so critical and the role that technology can play in simplifying all that to match that iPhone experience that most people just seem to expect as standard now. And that story Matt shared of the standard day procedure and of a rotary cuff surgery that would cost $64,000 in some circles and only $10,000 in others certainly made me appreciate the NHS here in the UK, as most Brits, including myself, are very guilty of taking that stuff for granted, where they can just walk in anywhere and have that procedure completed without worrying about figures like that. So it was great to hear more about Matt's inspiration behind Point Health, his personal story, and helping this Brit understand US healthcare billing, making it a little bit more clearer because it is an incredibly complex system, and how technology can simplify and help families navigate thousands of dollars in healthcare bills each year, not to mention all the challenges that he sees ahead and opportunities too. So, Matt, thank you so much for taking a little time to sit down with me. And we do have listeners in 170 countries to this podcast now. So I want to learn more about how tech is transforming healthcare in your town, city, state, country, wherever it is you're listening to me in the world. I invite you to email me now, techblogwriter@outlook.com. My website is techblogwriter.co.uk. You'll find links to all my social channels there. I'd love to connect with you all and hear your story. If you just want to send me a quick comment or a quick point of view, please do that and I'll read it out on the podcast. If you'd like to dig a little bit deeper and offer your points of view and share your insights right here on the podcast with me, we can do that too. In fact, we can do anything. We write our own rules here. So keep those messages coming in. I'll return again tomorrow. We'll tackle another subject of how technology is transforming our lives, our work and our world. But before I ramble on anymore, just a big thank you for listening. And until next time, don't be a stranger.
Thank you for listening to the Tech Talks Daily Podcast with Neil C. Hughes. Remember, technology works best when it brings people together.